All right, to get you more on this story, we are joined on the line from Addis Ababa in Ethiopia by Dr. Mustapha Sidiki Kaloko, Commissioner of Social Affairs for the Africa Union. Hello, Doctor, and thank you for joining us. First and foremost, the AU has played a significant role in stopping Ebola. One step was to send health workers to the Ebola-affected countries in West Africa. How many have you deployed and from where, and what's been the impact so far?
Well, we have deployed close to 544 health workers to Sierra Leone, Liberia, and Guinea as we're speaking. And we're expecting to send up to 704 by the end of the year. And our target by January next year should be 1,000, which is a scale up to the original 200 that we were rotating before the scale up took place. And it has created a significant impact because, you know, the international communities mostly constructed treatment centers, laboratories, you know, and hospitals, which required manning by health workers. And this is where our attention was directed at.
All right. Well, the collaboration with the African private sector has successfully raised resources. Tell us a bit about this and how much has been raised and what it is being used for.
Well, this actually was a very good example of what the convening power of the African Union can do. The idea was came up on with by the chairperson of the African Union, Dr. Nkosazana Dlamini Zuma, and as we are talking, we have pledges of up to about $32 million. You know, where the MTN group was topping the list with $10 million. The Dangote group in Nigeria pledged $3 million, Econet 2.5, Mustapha Family Trust 1 million, Stenback Family 1 million, Afrexim Bank, you know, again 1 million, and quite a number of contributions that have come on that have made the scale up possible.
All right, Doctor, let's talk about vaccines a little bit. Some say the absence of a vaccine to cure Ebola is because it's a disease found in poor countries. What's Africa input in this area?
That is quite correct, because this is a disease that thrives in countries with very weak health institutions, right, as exemplified by the three countries, which are in fact post-war in West Africa. These are post-war countries that have been doing very well, actually, in terms of economic recovery. And we're hoping that we should be able to improve the conditions there. But the issue of building health institutions applied before the epidemic. It's applying now. We need that even before the epidemic is controlled, and definitely in the future. We need those institutions propped up.
Okay, but Doctor, can you speak more to the vaccines? Would they be to prevent the disease or more or less just to cure the disease?
Well, it goes both ways. You know, vaccines actually should be preventing the disease, you know, but as we are talking, we're having a lot of conflicting reports, you know, because we rely actually on WHO in terms of the progress on vaccine. I think the last time I spoke to officials from there, we are saying that the earliest something could probably come on will be around mid-2015. I don't have much information on that. I know trials are going on, but this will be mostly on prevention of the disease. Of course, there are other efforts in terms of providing serum that one can use in the issue of treatment of the disease. And for now, we have centers in West Africa where we hope to send our personnel in case they fall sick, you know, to benefit from this treatment.
Okay. Well, sir, you're pleased for countries not to impose flight bans from Ebola-affected countries. How is that turning out?
Unfortunately, since we've started this campaign against Ebola, that's the one area where we haven't done very well at all. Stigmatization is still very rampant on the continent, and we haven't made much success in terms of air flights being maintained in these three countries. I think so far only Cote d'Ivoire, Air Cote d'Ivoire decided to start flying. And the paradox of this is that we still have flights like SN Brussels and Air Morocco serving those countries, but the member states are still very, very reluctant in terms of reopening flights to these countries. We haven't gained much success in this aspect at all. Stigmatization is still one of the biggest problems in our campaign for the fight against Ebola.
All right. Doctor, before I let you go, what lessons do you think Africa has learned from Ebola?
Well, I think the main medicine here, the main lesson we are learning from this is that it's not only the 3 countries that are affected right now. If you go around Africa, you can find quite a number of countries, if faced by the same problem, will have similar epidemics. So it's our job to do something about it right now. And this is what we are working on when we start thinking of the post-Ebola efforts in Africa. And this leads us to the formation of the African Center for Disease Control and other institutions that we're planning to put in place to make sure that we can address an issue like this if ever it comes up again.
Okay, Doctor, I know I've said I'll let you go, but we got to ask you just one more question. Doctor, why do you think that such an epidemic has risen in rural parts of Africa as opposed to perhaps the city center?
Well, that is a very difficult question to answer. It's very, very scientific in that you have the pros and cons here. There are some people who talk about the disease being transmitted, from wildlife, in this case, the fruit bat, and the wildlife, to the human beings. And there are some people who talk about mutations, making sure that there is a human-to-human transmission. There are quite a lot of views. But as to why an epidemic that was in Central Africa, in the Democratic Republic of Congo, and around the area of Gabon should suddenly rise up all the way in West Africa, that's something I have not been able to get a clear answer for. So my opinion is that we should all be on the alert. We develop our health systems, and we plan very well in case, we have the epidemic in our hands. I'm talking about all African countries.
Thank you, Doctor. Thank you very much for your insight and analysis. We'll talk to you again soon.